Okay, let's start by talking about Medicare enrollment. Who pays for health care in the United States today? Well, if you're under 65, your health insurance is usually work-based. If you're still working, your employer probably provides health insurance. If you're retired, you might have a retiree plan. Or maybe you've recently left your job and have extended your employer coverage at your own expense under COBRA. Maybe you've purchased your individual insurance policy. After age 65, Medicare generally pays first. That is, our health insurance system is set up so that once a person becomes eligible for Medicare at age 65, most private insurance becomes secondary to Medicare. So when you incur a health care expense, the bill is submitted first to Medicare. After Medicare pays what it's going to pay, any other insurance you have may pay some or for all of the rest. The only exception is employer group plans that cover 20 or more employees. So if you're still working and covered by such a plan, or if you're covered as a spouse under such a plan, your employer plan will pay first. This has implications for enrollment, as we'll see in a minute. What this means is unless you're covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. What if you don't enroll in Medicare on time? The consequences are pretty dire. First, you'll be charged a late enrollment penalty. The longer you go without enrolling, the higher the penalty will be, and it will continue for the rest of your life. The second consequence is that your health care expense may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up being stuck for the whole bill. And finally, your private insurance options may be limited. If you're in poor health or have a pre-existing condition, the private insurers that coordinate with Medicare may have to take you if you sign up for Medicare unless during your enrollment period. But if you don't, and you go to apply for private insurance later, you may not be able to get insurance, or you may be charged a higher premium. Okay, let's step back a bit and ask, what is Medicare? Well, it's a national insurance program for people over age 65. It was signed into law in 1965 by President Johnson. It's administered by the Centers for Medicare and Medicaid Services, and enrollment is handled through the Social Security Administration. Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the United States continually for at least 5 years. Some people under 65 can get Medicare if they receive Social Security disability benefits. Our discussion today will just focus on the first group, people over 65. Medicare is divided into 4 parts. Part A covers part of the cost of hospitalizations. Part B covers part of the cost of medical services such as doctor bills, procedures, and diagnostic tests. The bills for Part A and B are paid by Medicare. Part C and D are where private insurance comes in. Part C is an alternative way to get Medicare. You can sign up for a Medicare Advantage plan offered by a private insurer and get all of your services, Parts A and B, and usually prescription drug coverage as well through the plan. Instead of Medicare paying for your hospital bills, it pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan is responsible for managing and coordinating your care. There's a lot of folks that in our area that are in a Medicare Advantage plan, typically Kaiser, retired government employees, that sort of stuff. A lot of people have a Part C. They don't know it as a Medicare Part C, but that's what it is. Part D is prescription drug coverage. It's offered by private insurance insurers who contract with Medicare. Each prescription drug plan is slightly different, which is why you want to shop carefully for your drug plan. Even if you don't take any prescription drugs when you first go in Medicare, you'll want to sign up for a Part D drug plan, because if you go without drug coverage for very long, you'll face a penalty when you finally do enroll. So there's two ways to have Medicare. This rather blurry image came from the Medicare and You booklet. It shows that there are two ways you could have Medicare. If you go with the original Medicare, you sign up for Parts A and B. Then if you want prescription drug coverage under Part D, this shows drug coverage is optional, but it can be dangerous to go without drug coverage. So we're recommending that everybody plan to have some kind of prescription drug coverage starting beginning of our Medicare coverage at 65. In step 3, you decide if you want supplemental coverage. Again, Medicare shows this as optional. We think it's pretty important. Medicare leaves too many gaps. We'll talk more about this in a minute. The second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. There are many companies in this area. I mentioned Kaiser is one, offering Medicare Advantage plans. Also, UCD HealthNet has one. So if you go this route, it will be important to shop for plans and find the best one that meets your needs. Again, drug coverage is shown as optional, but we would recommend you choose a Medicare Advantage plan that offers prescription drug coverage. If you're receiving Social Security when you turn 65, you will automatically be enrolled in Part A and B. If you're working and covered by an employer group, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Medicare Parts A and B, and your coverage will start on the first day of the month you turn 65. Parts C and D are not automatic. If you want a Medicare Advantage plan, you'll have to contact the insurance company, offer it, and up for a Part C through them. Or if you want to stay with the original Medicare and have a standalone Part D prescription plan, you'll need to decide which insurance company's plan you want to go with, and you'll have to proactively enroll. You should do this at the same time you're enrolled in Parts A and B before your 65th birthday.